In this instructional video, we'll demonstrate how to perform the assisted cardiac output calculation on the Sonosite LX. The first measurement of this calculation is obtained in the parasternal long axis with the orientation marker pointed towards the patient's head and right shoulder. We'll demonstrate this view with the patient in the supine position. However, you may need to roll the patient onto their left side for optimal imaging. Place the phased array transducer in the region between the clavicle and the nipple line. You may have to adjust the transducer slightly according to the position of the heart in the patient's chest. The goal is to clearly see the aortic valve as it opens and closes, and to accurately measure the left ventricular outflow tract known as the LVOT. Take care to measure the LVOT at its largest dimension and optimize your scanning to achieve the clearest view of the aortic valve opening and the attachment of the aortic valve leaflets. Using the zoom function on the control panel may help with this measurement. Press freeze. Use the gain wheel or the touchpad to move back through the frames. When the aortic valve is open, you can clearly see the leaflet attachments. Press Calcs from the menu options. Select Assisted CO, select LVOTD, known as the left ventricular outflow tract diameter. Use the touchpad or the touch display to place the calipers at the point where the aortic valve leaflets attach. If using the touchpad, the Select key will toggle between calipers. To save the measurement into the calculation package and allow you to move forward with the remainder of the calculation, press Save. The second measurement of the calculation package is taken in the apical 5-chamber view. For optimal imaging, it is advisable to roll the patient onto their left side and bring their left arm towards their head. This brings the heart forward in the chest and makes it easier to see between the ribs and around the lungs. The orientation marker is pointed down towards the bed and the transducer is placed on the left lateral ribcage. On the 4th or 5th intercostal space, it's easiest to start in the apical 4-chamber view. Slight transducer adjustments may be needed to elongate the left ventricle from the apex to the mitral valve. The left ventricle and atrium will be on the right side of the image and the right ventricle and atrium on the left side. Once the apical 4-chamber view is achieved, fan the transducer towards the anterior chest wall and slightly rotate the transducer clockwise to bring the aortic valve into view for the apical 5-chamber. Press D to start pulse wave Doppler. Position the sample gate in the same location that the LVOT was measured in the parasternal view in the opening of the aortic valve. Press D again to start the Doppler trace. Adjust the Doppler scale and baseline as needed. Once you have obtained a trace with several waveforms, press Calcs while the live Doppler is on. Notice how the cardiac output will automatically update in the upper left of the touch display, calculating in real time as the heart is beating. The system automatically traces up to 5 waveforms. Once you are satisfied with the pulsed wave trace, press Freeze. If you see a waveform that needs to be corrected, you can use the Select key and the touchpad to adjust the calipers as needed. If no adjustments are needed, confirm the measurements on the right side of the control panel. You may also delete unwanted measurements here. The VTI variation percentage calculates the percentage of change between the waveforms captured. To save the measurements with the image and to the report, press Save. The average cardiac output can also be seen within the report by selecting Report and Worksheet at the home screen. The Calculations menu on the LX is designed to optimize your workflow for a fluid challenge. To do so, start with the baseline or pre-cardiac output as previously described. You'll then perform a fluid challenge or a passive leg raise to mimic a fluid bolus. Then obtain the cardiac output calculation again, this time using post-cardiac output from the Calc menu options. The LVOT diameter measurement can be reused for both calculations, as the LVOT is not dynamic and does not change. The system will automatically calculate the percent change between the pre, also known as the baseline, and the post-cardiac output. This will be shown on the control panel on the left side of the clinical display, and within the report upon pressing Save.